Great. Well, thank you. Thanks, everyone, for being here. My name is Robert King. I am the CMS reporter for Politico. And I'm so happy to be here with Democratic Congresswoman Diana DeGette of Colorado. And I wanted to first kind of dive right into the news of the day, or I guess yesterday, when there was a major reduction in force notice that was sent out across HHS. And I wanted to get your initial thoughts on this kind of wave of firings, and what is the reaction that you have been getting from your constituents and from other people in the healthcare industry?
Well, thanks for having me, and I'm really happy to be here, especially on the heels of that spirited debate in the last panel. I'm happy to be here to kind of back clean up, and I will say that this announcement this week by RFK Jr., Donald Trump, and Elon Musk is the most devastating thing that I have seen to happen to biomedical research in the nearly 30 years I've been in Congress. And I don't say that lightly, but our biomedical research, device and drug approval, and public health that we do at the CDC is the gold standard for all of the whole world. And what the administration has done through these cuts, it's not just layoffs. They've also been slow walking and canceling research grants for critical research across the country, not just at Bethesda, but also at places like Anschutz Medical Center in Colorado, right outside my congressional district. They've been canceling research grants. They've been laying off researchers and professors. And they have been doing it in a way that is completely without any kind of rhyme or reason. It seems to me their main goal is just to meet their goal of firing 20,000 people without regard of who they are or what they do, and also consolidating institutes. So it's not just devastating to the future of research or to the gold standard of the United States in these areas, it's also illegal. And this is what my colleague Jake Auchincloss was just trying to say in the previous panel. Congress, under Article 1 of the Constitution, has the ability to authorize these agencies. And when we heard about this last Thursday, I'm a lawyer by training, and I thought to myself, this is illegal. And the reason, and so I went home because I'm a nerd, and it was like 11 o'clock at night, I got online, and sure enough, all these agencies, plus all the institutes at the NIH, are all authorized by Congress. And so I think we need to make our agencies work as best they can and as efficiently as they can, continuing to do this research. And that's why in 2006, some of you might recall, Congress worked together, Democrats, Republicans, House, Senate, with the White House and the agencies to restructure the NIH. Remember that? Mm-hmm. And then in 2016, Fred Upton and I, Republican from Michigan, we worked with Dr. Francis Collins, and we worked with the Obama administration, and again, House and Senate, Democrats and Republicans, to pass 21st century cures. So we should and can be doing it, but not in a meat-axe manner. I will tell you that the response I've been getting is horror. I've been getting calls from former senior officials at these agencies, not just Democrats, but Republicans. I've been getting calls and pleas from researchers. The patient advocacy groups, they're worried that we're going to stop doing pediatric cancer research. And privately, many of my Republican colleagues have been expressing concern and fear, although they're too afraid of Donald Trump to say anything publicly. So that's what's going on right now.
So that's a good segue. Not a lot going on, I suppose, but that's a good segue actually into you serve on a committee that has a very bipartisan history, energy and commerce. You just referenced 21st Century Cures, which was a major bipartisan achievement. You know, how will these cuts impact your relationship with Republicans on the panel? I mean, does it mean that there's going to be less likelihood of bipartisan support on other issues, things like the Support Act as well?
Well, so you're right. Energy and commerce, particularly when it comes to healthcare policy, particularly when it comes to our public health and biomedical research, we've always worked quite well on a bipartisan way. And this is why I'm saddened by the fact that the Republicans in Congress seem to have abrogated their authority under Article 1 of the Constitution to the Trump administration. But you know something? Disease doesn't just impact Democrats or Republicans or even unaffiliated voters. It impacts every family in America. And so I know those of us on the Democratic side of the aisle are willing to continue and eager to continue working on these very important issues. But we don't think that Congress should be used just as an organ to rubber stamp anything the Trump administration wants to do. We think we should have oversight. We think, you know, all the members, the Democratic, I'm now the ranking Democrat on the Health Subcommittee in Energy and Commerce, and all of the Democrats on that subcommittee sent Secretary Kennedy a letter early in the session, right after he was confirmed, asking him to come and testify before Congress. They usually do that, but there's been no indication that that's going to be scheduled. I'd like to have him come over and explain how he thinks his healthy initiative and taking cod liver oil or vitamin A is going to help pediatric cancer or rare diseases.
We've heard that some Democrats are potentially reluctant to support things like COSA and support. Is that an area of leverage potentially that the lack of support could be used as a way to kind of help address or mitigate some of these cuts?
Well, I think that, of course, we were supposed to have a markup of some of these bills tomorrow, but since Speaker Johnson apparently doesn't want to give maternity leave to young congresswomen, he vacated the votes for the rest of the week, and the whole markup got canceled. So I suppose we'll have that markup, and I think people will look at those bills one at a time. But as Congressman Auchincloss just said, that sort of, again, ignores the issue that we had this great big agreed-upon package in the continuing resolution last fall, 51 separate bills, many of them healthcare bills, things like the special diabetes research that I've championed as the co-chair of the Diabetes Caucus, and many, many other healthcare bills and other bills negotiated as a package and then just abruptly stripped out of the continuing resolution when Elon Musk said he didn't want to do it. So we've been really pushing to, and he said this, we've been really pushing to have this bill come up on the floor. It was agreed upon, it was negotiated, and it's going to impact millions of Americans. It could come up, as he said, it could come up on the floor on the suspension calendar, and it would pass overwhelmingly. So we're hoping that that can happen. In the meantime, I don't really understand the decision just to pick and choose some of those bills, but I think people will look at them on their merits and decide. I don't think they're going to hold good legislation hostage, and don't always let the good be the enemy of the perfect.
But how exactly have these changes and these firings are going to impact your negotiations with Republicans and even the drafting of legislation where, like 21st Century Cures is a great example where added a lot of funding, new programs and everything, but now it seems like, are you operating under a new paradigm? Is there a new world order, I suppose?
I'm really hoping that my Republican colleagues will finally see what's going on here and will pull back their power and that we can work together. I mean, I hope we can get the secretary in to testify, and I would hope that I just heard that next week it looks like the Senate is trying to, on a bipartisan basis, going to try to have him come in and testify. I would hope that my committee would do that too. And I would hope we would really take back these issues in a bipartisan way, because it's really important that we move forward on healthcare policy, not stay frozen, and certainly not make it a partisan fight. At the end of the last Congress, I developed Cures 2.1, advancing the goals of 21st century cures, with then Congressman Larry Bouchon. And Congressman Bouchon, of course, he retired, but we put together a white paper before he left. And I've been working on recruiting a Republican co-sponsor. I have many possibilities. I work quite well with many of the senior Republicans on energy and commerce, but all of this has been put on hold, just like everything else, until we get through this chaos.
So speaking of things being put on hold but that are going to be coming up soon, is the issue of the Obamacare enhanced tax credits, which are going to expire after 2025 unless Congress does something to extend them. Have you had any chats with your Republican colleagues about a bipartisan deal on this issue?
So this is interesting, because this is all taken up in the whole issue of Medicaid. And my constituents in Denver, Colorado, it used to be that people saw sort of different buckets for health care financing. You know, you had private insurance, or you had Medicare, or you were poor, elderly, or sick, and you had Medicaid. Now everything has been blended because of these tax credits under the Affordable Care Act and the extensions after COVID and all this. And so my constituents just see this all as part of their health care. And so if we let those tax credits expire, then millions of Americans will suddenly see their insurance costs rise dramatically. And I think, and they're going to see this as part of this whole debate around Medicaid. Now, over 70% of Americans support Medicaid, which we're seeing in this fight that we're having over the budget reconciliation bill, and the tax cuts for billionaires that Elon Musk and Donald Trump are pushing. But in fact, the American citizens are just going to see this as part of the whole Medicaid issue. So I think this debate is going to continue to happen throughout the year as we debate the Medicaid cuts.
Have you talked, though, with any of your Republican colleagues about, because there's likely going to be some type of deal. Republicans, I don't think, were big fans of the Affordable Care Act. Have there been any conversations?
I noticed that myself.
Have there been any conversations yet about this? Or?
Well, I think that my colleagues now recognize that the Affordable Care Act is here to stay. But I think you'd have to ask them what their opinion is of the tax extension, because I have not asked them about that specific issue. But all I know is, as the debate continues, is Americans now don't see this as should we have the ACA or not. They see this as this is in part how I'm getting my health care. And of course, everybody here knows health care costs are continuing to rise. We can have a long conversation about that another day.
Yes.
But as health care continues to rise, as premiums and copays continue to rise, then my constituents just see this as all part of a package. So if the Republicans try to cut Medicaid as part of a reconciliation package, and then they try to eliminate these tax credits, and if they start talking about other Social Security and other things, I think that's going to be really politically difficult.
That's a good segue, I think, into my next question about Medicaid. And of course, the Energy and Commerce Committee, which you sit on, is searching for about $880 billion in savings for the larger reconciliation package. Is there any way that your Republican colleagues can get to that number without touching Medicaid, as they have said that they're going to try to do?
The short and accurate answer is no. And the reason is because we were directed in the budget resolution, the Energy and Commerce Committee was directed to find $880 billion in savings, coincidentally, just the amount of Medicaid over the next 10 years. But then when we said, whoa, we would have to cut Medicaid to do this, they said, we never said the word Medicaid. We can do it in other things in the Energy and Commerce Committee. And of course, as you know, the Energy and Commerce Committee has very, very broad jurisdiction. So we started looking at, well, where else could we cut? Because broadband, or could we cut spectrum, or could maybe EPA or anything? Well, we realized all the rest of the spending in the Energy and Commerce Committee, total, all the rest of it, $500 billion. So if you zeroed out everything else that we do, you'd still be $330 billion short. This is why it is inaccurate to say that we could, we can find other places to cut, because we just simply don't have that much money.
Some of the issue has focused on concerns among Republicans surrounding kind of the state's use of federal funding. Republicans have been kind of angry about issues surrounding provider taxes. They believe that states are using a loophole to tax providers in order to get a higher federal share of money and then make providers whole through higher payment rates. There's been some talk about trying to get savings through that, get savings through addressing state-directed payments. What are your thoughts on kind of going after what your Republican colleagues say is a money laundering move by states? Well,
so I'm sure the states would beg to differ with that characterization. However, if the Republicans actually want to look and see if there are illegal activities or money laundering by the states, they should have a hearing on that. But mainly what they want to do is find an excuse to cut the Medicaid funds that go to the states, with the thought that states could just make up the difference. And a lot of people have said to me, of course, this is going to hurt the red states the most because they won't raise the money, but it's also going to hurt blue states like Colorado and California, where we have constitutional amendments that say you can't deficit spend. And already in Colorado, one of our biggest budget items, I think the biggest budget item in the Colorado budget is the state Medicaid match. And so if you cut Medicaid to the states, no matter what you label it as, then the states aren't going to be able to make up that difference. Colorado itself has a $1.2 billion deficit this year that they're going to have to make up. So also, if you make these adjustments to the states, even if you added a work requirement, which most experts say won't work, you still don't get up to $880 billion in saving. You can't get to that number without cutting large swaths of recipients off of Medicaid, period.
So I want to know, what tools do you have to kind of halt the actions that have been happening, like the cuts at the agencies? And there's been a lot of anger that has been spilling out into hearings. Do you think that is going to continue, or what other strategy are you going to employ?
Well, I think that sunlight is the best disinfectant always, and I think that in the U.S. House of Representatives, the party that's in the majority, even if they're in the majority by 2 or 3 votes, it has complete control over the agenda, and so I can't make Secretary Kennedy come in and testify, even though I think he should. But what I can do is communicate with my constituents and talk to them about what's going on. Last Saturday in Denver, I had a Medicaid listening session wherein I invited patients, providers, and others to come and talk about what Medicaid means to them and what would happen if it was cut. And I got some incredible stories from those folks that I'm going to continue to push out there. So I think, and that's what we've been doing in the hearings too. We had a hearing on fentanyl, and so we took the opportunity to ask the experts who were testifying what would happen if people lost their Medicaid in terms of drug treatment and prevention, and they all said, well, it would hurt. And so I think the truth coming out is the best thing we can do.
So,
Also, P.S., the elections last night showed people should be very, very worried about just trying to jam things through that are going to impact Americans.
So Senator Cory Booker, and I'll get you out on this, Senator Cory Booker broke the record for the longest filibuster, I believe, yesterday. There is another record, I believe, for Energy and Commerce of a 27-hour markup during the previous Obamacare repeal fight. Are you all going to...
I was there.
Yeah. Are you all going to be going for that record?
That suit away.
Are you going to be going for that record potentially?
I don't. I mean, I think that communicating with people about what's going on is really important. And so whatever tools are the most effective at that time, that's what we're going to do. I was there last night when Senator Booker broke the record, and it was powerful because he was talking about how these policies are going to impact everyday Americans. And I mean, I've known you, and I've been around a long time. I'm one of the most bipartisan people in Congress. It's really hard to get me this angry, and the reason I'm this angry is because I think millions of Americans could lose their health care and potentially could lose their lives. And so that's what motivates me.
All right, well, thank you so much. Thank you, Congresswoman, for speaking with us today, and we appreciate your time.
Thank you.
Thank you.